Hi everyone, today we're talking about some disturbances in the taste sensations. Starting off, first of all, we have ageusia. Ageusia is a complete loss of taste sensation. Person cannot perceive any of the basic tastes. There are five primary tastes: sweet, salty, sour, so SSS, and then bitter and umami. This is usually caused by damage to taste buds or damage to the facial nerve or the glossopharyngeal nerve or central regions. This is very important. So primarily it could be caused by the taste buds, right? Because buds are the receptor cells. If there's damage to them, the person won't be able to sense any sort of taste. And then facial nerve, very important. This brings about taste sensation from the interior two-thirds of the tongue. And glossopharyngeal nerve, it brings about taste sensations from the posterior one-third of the tongue. So basically, I'll tell you what is the transmission of taste signals, even though that is kind of irrelevant right now, but it's fine. I'll just recap that as well. So from interior two-thirds of the tongue, the taste sensations, they pass where the lingual nerve and then to the chorda tympani, and then to the facial nerve, and eventually into the tractus solitarius, which is situated in the posterior region of the brainstem. And same way, from the posterior one-third of the tongue, the sensations pass where the glossopharyngeal nerve and directly into the tractus solitarius, which is in the posterior part of the brainstem, right? So this is your first order neuron. It goes to the brainstem. And then from brainstem, exactly where the nucleus of tractus solitarius, from there the second order neuron it originates. And what does it do? It Second order neuron, it originates and it goes directly to the thalamus and ventral posteromedial nucleus of the thalamus. So this is where the second order neuron terminates. Then the third order neuron, it originates from the ventral posteromedial nucleus of the thalamus, and it goes and stops at the post-central or terminates at the post-central gyrus. So post-central gyrus in the parietal cerebral cortex, deep into the sylvian fissure or the opercular insular area. So this is the transmission of taste signals into the central nervous system. And then you have hypergeusia. Hypergeusia is basically increased or exaggerated sensitivity to taste. This is where a person experiences excessively strong taste than normal. This is normally seen in pregnancy, Addison's disease, anxiety states, or after taste bud regeneration. Also, one thing I have to mention here in Ageusia that in COVID-19 there were a lot of people who, they couldn't either smell or taste. So they either lost their sensation of taste or smell, or both of them. So, due to infections as well, there are high chances that a person can develop ageusia. So, one of the reasons should also be mentioned here as infections, because the prime example being of COVID-19. Then hypogeusia is decreased sensitivity to taste, as you can already guess. And this is common in aging because in aging, the receptor cells of the taste bud they start decreasing. Smoking, very important. Then zinc deficiency, oral infections, or nerve damage. Dysgeusia is basically distorted or unpleasant taste perception. A patient experiences metallic, bitter, or foul taste without appropriate stimulus. There's no stimulus. For example, a person is lying, he's not even consuming any sort of food, he's just lying down in the bed, but he experiences a weird taste, a bitter taste. This is after consumption of drugs like antibiotics and chemotherapy. You must have noticed after you've consumed antibiotics, you experience a very bitter sensation of a very foul taste in your mouth, or even metallic taste at sometimes. Oral infections, GRD, and nerve disorders. So, quick recap. Ageusia is basically a complete loss of taste sensation. This is usually in COVID-19 infection or different infections, damage to taste buds, damage to the facial nerve, which provides sensation from the interior two-thirds of the tongue, or the posterior one-third of the tongue, which takes the which is innervated by the glossopharyngeal nerve. So these are the possible causes of the ageusia. Hypergeusia is excessive or increased or exaggerated sensitivity which occurs in pregnancy or anxiety states or taste bud regeneration immediately after the taste bud regeneration. Hypogeusia is decreased sensitivity to taste, and this occurs in aging or smoking, very important, oral infections, nerve damage, or zinc deficiency. Dysgeusia, distorted or unpleasant taste perception like metallic, bitter, or foul taste. This occurs after consumption of drugs like antibiotics, especially or chemotherapy, oral infections, GRD, nerve disorders. So this here you can see ageusia, loss of taste; hypogeusia, reduced taste; hypergeusia, increased taste; and dysgeusia, distorted taste perception.